Hello, my name is Tosing Omolaja and you're welcome to NAFDAC and Your Health, where we bring you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics and medical equipment made available to us are safe and wholesome. Today on the program, we take you round the country to various zonal formations of NAFDAC and explore the agency's efforts at ensuring that the safety and health of Nigerians are not compromised.
Our investigation and enforcement is a very, very important aspect of our regulatory framework. The National Task Force against counterfeit and fake medicines and unwholesome food is resident in NAFDAC. It is in the Investigation and Enforcement Directorate. That is the National Task Force. Under that task force is the state task forces. And what we do is we give them heavy fines. Some we prosecute, but we give heavy fines and seize and destroy their products. It has to hurt in the pocket to set deterrent. So our work is huge in terms of ensuring that our people get the medicine they deserve, which is good quality medicine, food that they deserve, not unwholesome food. That is not food that will kill them. We are dismantling the cabals now, but we cannot do it overnight. So we fight day and night to ensure that those who are bringing in bad products are stopped. Part of what we are doing now is going to the source. We are going to the source in India and China so that they will know that they cannot just bring anything to the country. We have now a database of things that we are stopping before they even come. So again, it is Port Inspection Directorate that is directly working on that, but the Investigation and Inspection Directorate works on that if they happen to then get into the country, and we have to go after them.
We begin in the northeast zone of the country, where although insurgency and insecurity is rife, the agency still manages to carry out its mandate of safeguarding the health of the nation.
The northeast zone, it is the only zone that borders with 3 different countries. That's the Cameroon, Chad, and Niger. And all these borders, except for the small Lake Chad area, which is inhabited mostly by insurgents, all other areas, they are land borders. So these land borders allows for smuggling in of some of these unwholesome products. NAFDAC, as we are aware, the NAFDAC headquarters, under the leadership of the Professor Adeyeye, she has been meeting with some other relevant federal government agencies to see how best to ensure that NAFDAC play its role in these borders, and that to see that these products are not allowed into the country. And even if they find their way in, the state offices, through their routine surveillance, either scheduled or unscheduled, if they stumble across such products can be confiscated and it can be seized, and then finally it will be destroyed.
Such destruction was carried out recently in the zone. Substandard, falsified and unwholesome regulated products worth about £500 million were incinerated to ensure that they don't find their way into our markets or consumed by our people.
It is the primary mandate of NAFDAC to ensure that only safe, quality, and wholesome products are available for human consumption. So any product that deviates from these normal parameters, NAFDAC has the primary mandate to either seize it or sometimes clients voluntarily submit such products to NAFDAC for destruction. So such products were gathered from across the 6 states of the zone in Gombe, so that the destruction exercise anchored by the Directorate of Enforcement, Investigation and Enforcement Directorate went and coordinated that and destroy those products that totals over 500 million naira worth of various NAFDAC regulated products.
NAFDAC surveillance exercises are a constant part of the agency's operations and remains focused on regularly mopping up all regulated products that fall short of safety standards.
Right now they are in the field. They go around on the normal surveillance. In case they come across any of such products, it can still be subjected to similar regulatory process of seizure and then subsequent destruction.
In the Northwest, the agency's operations are equally unrelenting. Several unwholesome, falsified and substandard regulated products which had been confiscated were destroyed.
We have actually carried out the Northwest Zonal Destruction Exercise in which spurious items worth more than 600 million naira were destroyed in Kano. All the states in the Northwest Zone actually gathered their falsified and substandard products for destruction in Kano. It was a wide variety of items, mostly popular items. We have antibiotics, antihypertensives, anti-diabetics, and quite a number of items that are actually banned from circulation. We got some narcotic drugs that are not supposed to be available in the market that were withdrawn, some in high dosage forms that were actually seized from different marketers in circulation, and we retrieved them and got them destroyed in that exercise. The items are worth more than 600 million naira, and every bit of it was destroyed.
The Northwest has its fair share of challenges ranging from misuse and abuse of agrochemicals in agricultural products to security hazards. Irrespective of this, the agency remains resolute on its mandate.
We know the level of insecurity in some parts of the Northwest. There are local governments we can't even go to. But apart from that, generally speaking, the management of NAFDAC has done very well in terms of providing the logistics, the vehicles. We got quite a number that are brand new, and that has made operations reasonably better than it has been in the recent past. Up north, we have grain markets, major grain markets that actually take care of the country and even some countries in the region. And therefore, we have this problem of grain preservation, where people use insecticides that are quite dangerous for the human being. And therefore, we are constantly enlightening this category of traders to be mindful of the chemicals they use and then the procedure for applying them and how soon they can be used after application. We equally have problems of ripening of fruits. This again is a very major problem. We have carried out enlightenment campaigns in major fruit markets in Kaduna and other states of the Northwest Zone. That is ongoing. We have officers that are always in the field. We have investigated quite a number. They have been reported duly, and that is an exercise that is still ongoing.
At the Federal Capital Territory, the same measure of surveillance and enforcement are carried out regularly.
The FCT, we carry out surveillance. Surveillance in the aspect of people manufacturing unregistered products, people selling unregistered products, people hawking drugs, including herbal medicines. Some hawk in vehicles. They put loudspeakers in vehicles to hawk herbal medicines. We go around, surveillance, do surveillance, and we arrest them and we sanction them according to the agency's guidelines. Now, the products that are unregistered or fake products, we mop them up, we seize them, and they are destroyed. We had a destruction exercise about 2 months ago of these products, those that are seized, and some that were voluntarily handed over by the companies, expired products, and products that didn't meet specification. They handed them over to us and we destroyed them. And then so our surveillance and monitoring continues. And then also we have the food companies also. There are also water producers that we have sanctioned in some areas of the Federal Capital Territory where we close them. We invite them to the office to initiate registration of those products if they want to continue to manufacture them.
NAFDAC and your else will be right back. Please stay tuned.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you're just joining us, you're watching NAFDAC and your else. In the South-South zone, enormous number of unwholesome foods, falsified and substandard drugs were also removed from circulation and destroyed.
We had almost 15 trucks altogether from each of the various. Some states had 2 trucks, 3 trucks, 4 trucks, even six trucks of seized products. And these products comprised of a lot of spurious and unwholesome products. Unregistered drug products, banned drug product, prohibited drug products, for example, tramadol, in a very, very high potency that is totally not allowed in the country. We all know that tramadol is an addictive product and the kind of damage it does. Banned products like analgin that has long been banned. Unfortunately, such things are still coming in, things like butazolidine, drugs that have been found to cause necrosis and damage the kidney very, very badly. Analgin is one of those drugs, butazolidine is another one. And yet, unfortunately, our people still bring those things in. Unfortunately, either by direct contact or by information from concerned Nigerians, and even at the ports, we've been able to prevent such products from getting into circulation and causing the various damages that I had already enumerated about such drugs. Then we've had a lot of unwholesome food products. Like, for example, we go around supermarkets, markets, and various retail outlets and even wholesale outlets. When we get information, sometimes during our routine visits, we see those products and we seize them once we see that they are not wholesome, they're unregistered, not wholesome, bad, or whatever, they are seized. And such products, when we seize such products, we have a holding facility where we keep them. And then we also have some cosmetic products. We know a lot of cosmetic products that have banned items in them that can destroy the skin. And so many various other products or medical devices that are either expired or not suitable for human use. And then we have some companies, those ones are law-abiding companies that once their product expires, they contact us, they write to us, and they surrender their expired products to us for destruction. So those are the various ways that we have compiled all these products together. And when the Investigation and Enforcement Directorate organized the destruction exercise, we're able to participate in it. And all the various products were run into the tune of over 800 million naira that were almost $1 billion naira that were destroyed, and the destruction was done for both South-South zone and South-East zone. It was a 2-zone affair that was done at Oka in Anambra State. Even after that destruction exercise at Oka, we had about 4 containers of fish that had gone bad, that was destroyed. So we have various impromptu destruction exercises like that we do from time to time throughout the year. So that way, we are able to prevent unwholesome products from getting into circulation and from our people getting poisoned from such unwholesome products.
NAFDAC is constantly on the prowl for those who may have snuck through the cracks and made their way into the country, or those within the country, engaged in the production of illegal and/or unwholesome regulated products.
Even as I speak, there's the Interpol initiative called Operation Pangea. We are trying to get counterfeit medical products. If I should use the WHO terminology, falsified substandard and falsified medical products all over the country. As I speak, we are carrying out that exercise. And there's also another one that we are doing, which is also within Interpol. It is named OVI, Operation Vigilant Interdiction. It is anchored around 3 areas, 3 principles. 1, prevention, deterrence, and public awareness. That is 1. The second one is disruption and interdiction. The third one is arrest and prosecution of COVID vaccines and related products. It is no longer news that people are trying to, or rather, we have avalanche of counterfeit COVID-19 vaccine. It has hit Africa, it's in Africa. And you know, once it gets to a country, it can get anywhere on the continent. So we are watchful. And we are using this opportunity as well to appeal to members of the public. If you see someone engaged in some of those nefarious activities, please let NAFDAC know. You have NAFDAC offices all over the Federation, and you have the NAFDAC Investigation and Enforcement Directorate Office, which houses the Federal Task Force on Counterfeit and Fake Goods and Unwholesome Processed Foods. In Lagos, it is at 13/15 Mobile Road, Apapa, Lagos. Come to us. Our telephone numbers are there. Try and call us. Don't allow these people to kill you. Don't allow them to kill you, because you have a right to protect your life, and we are here to help you.
A matsayi wani bangare na NAFDAC don haɗin gwiwa a hana fasowa guba abinci da kuma kiyayyar lafiyar al'umma. Hukumar nan na ba da shawara ga dukkan jama'a a ɗauki mataki na rigakafi kula da abinci. Sinadarai ba abinci ba ne, a haka kada ɗanɗano da harshe tana kawo haɗari ga lafiya da kuma tana iya halakawa. Amfani da kwayan paracetamol ko wata kwayan magani a dafa nama na kawo hadari. Tana iya lalace da hanta, kwada ko wasu sashin jiki. Kada ko sanshen yayan itace da calcium carbide tana iya sa cutan ciwon daji ko ta lalace koda ko hanta. Akwai kawon hadari a koran kwari da kuda a abin sarrafawa abinci da maganin sniper da huwa ba ta cire dafin sniper. Kada haɗe wata kakuda ko shirin ganye wanda ba ta da lamban NAFDAC tana iya kawo mutuwa. Yawan sinadarai dandano, kayan yaji abinci da ke shigen sukari ko leda na kawo haɗari ga lafiyan jiki. Kar a kara sinadarai ga abinci ko abin sha don sa tami ko kyautatan dandano. Lafiyan abinci harkan kowa. NAFDAC na kiyayen lafiyan al'umma.
That's our package for today. Please join us same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Remember, COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.